Infertility is a very important medical problem. It is important because it's extremely common. A lot of people do not understand how common it is. 1 in 6 couples suffer from infertility, and this is a worldwide problem. And it's also very important. If we imagine that the human race couldn't reproduce, and that hopelessness that we would have, that's what infertile couples feel. It is a primal function to procreate. And to have children is a very, very important part of humankind. The struggle with infertility is actually increasing internationally, and one of the reasons is the age of the woman when she tries to start to have a family. This is increasing, especially in the Western world, quite dramatically. And as a woman ages, reproductively, her ability to have a child decreases. So it's a means of achieving fertilization outside the body and transferring an embryo to the womb so the woman can become pregnant. It's a very successful technology. It's developed enormously in the last 30-odd years, ever since the first baby was born in the UK in 1978, indeed the team that I was involved with back then.
Illumina's mission is to improve human health by unlocking the power of the genome, and in the field of reproductive and genetic health, that's exactly our core value, is to really help empower patients to make informed decisions right across the whole reproductive and genetic health continuum, from the prospective parents right through to the newborn. We have products that address many touch points across that continuum.
There are about 60,000 IVF cycles undertaken in the UK, and about 2% of all babies born now are from IVF. So it's an extremely important procedure, medically accepted, for the treatment of infertility. About 1 in 3 IVF cycles result in a baby. And in fact, it's having the baby that is the real outcome in IVF. To achieve a 1 in 3 is actually better than nature. So we're doing very well in our IVF technology. But for patients who come to IVF clinics, they want a better than 1 in 3 chance if we can possibly do it. So the challenge is to get the success rates higher than they are even today. And enabling us to do that must be ways of increasing our technological understanding to find the most viable embryo, because we believe that one of the main reasons why only 1 in 3 of the cycles results in a baby is because a huge number of embryos, possibly up to 70% of embryos produced, are not viable. So the challenge is to find the most viable embryo.
And one of the difficulties and one of the challenges from an IVF clinic perspective is, how do we choose the embryo? Maybe there are 5 embryos to choose from. How do we choose which embryo is the most viable embryo that will result in an ongoing pregnancy and a healthy live birth? That's really the challenge in IVF, is how to choose the most viable embryo. There are many reasons why IVF fails. In fact, only 30%, and this is a global number, approximately only 30% of IVF cycles are successful. We typically hear about IVF, we typically hear about the successes of IVF through talking to friends and colleagues, but actually what we tend not to hear is about the number of times that IVF fails. We know that one of the major causes of IVF failure through many scientific publications is embryo aneuploidy. That's embryos with an incorrect number of chromosomes. So with pre-implantation genetic screening, or PGS for short, what we're able to do is to select from a cohort of embryos. So if a woman produces, let's say, 5, 6 embryos, we're able to select those embryos that contain the correct number of chromosomes.
Normal conception produces a high level of chromosomal problems in eggs. We know, for example, in women, even at age 35, up to half of her eggs can have a chromosomal anomaly. Once a woman starts approaching 40, or even in her early 40s, between 80 and 90% of her eggs will have a chromosomal anomaly. So you can see the challenge that we really face is that if we have a number of IVF embryos, which one will not have an aneuploidy or a chromosomal problem? And that's what this PGS technology now does for us. It gives us not only the opportunity of the clinical imperative not to transfer a chromosomally abnormal embryo, it gives us a very real chance to improve success rates by finding the chromosomally normal embryo that is the one that will give us the highest chance of a live birth. So we have to have technologies now that can help us find that particular embryo. And that is a technology called PGS. It's a technology that allows us to screen for those embryos that may have a chromosomal anomaly, and allowing us to select those embryos that don't have any chromosomal problems, the chromosomally normal embryos. They will have the highest chance of making a baby. And now this PGS technology is being delivered to us by Illumina, enabling us to make screening very accessible to many, many patients. Chromosomal abnormalities is unfortunately unbelievably common in the human species. It's not just about after IVF.
After discovering that Keith and I had some problems conceiving naturally, we contacted Care here in Nottingham, who gave us some information about proceeding with IVF using PGS technology. We had a consultation with the doctor, and he told us about our avenues of opportunities that we had. He gave us lots of information about IVF and about PGS technologies. We realised that PGS was the route for us and to give us the best possible chance of having a baby. And really for us, it wasn't that much different than a normal IVF cycle, as the PGS technology happens in the background in the labs. The staff here at Care kept us informed of the progress of our embryos, and we were very pleased on day 5 after the PGS technology's taken place that we had a number of viable embryos left.
Traditional techniques are based on morphology, looking at the shape of the embryo, maybe looking at various metrics in terms of growth rates, certain parameters, but in effect that's very subjective and really is down to the skill of the embryologist. What we're able to do with pre-implantation genetic screening is really look at the genetic content of the embryo and determine whether those embryos have the correct number of chromosomes or not, and then from that cohort of embryos select only those embryos with the correct number of chromosomes. So often when people go through IVF, those patients want to give themselves the very best chance to have an ongoing pregnancy and a live birth. So incorporating PGS into that IVF cycle has been shown through mounting scientific evidence to improve IVF success rates. I had the opportunity to meet a patient recently at an IVF clinic, and they wanted to give themselves the very best chance. So they talked to the fertility doctor who advised them to include PGS, and they included PGS in their cycle, and they now have a healthy baby boy. So when you hear stories like that, you can really see, talking to those people, really the impact that Illumina technology has on patients' lives, and that's quite a nice feeling.
I think that anybody going through an IVF cycle would benefit from PGS. We do strongly believe that having PGS benefited us. We're very, very grateful, and there's not a day that goes by where we don't think how lucky we are to have our beautiful baby boy.